So colleagues, without taking much further time, I will at this point hand over to Mr. Mube to kick off and share thoughts with us regarding the progress, the challenges, and regulatory readiness of issues related to AMA. I'm going to request that in the interest of time, I don't go through the bios, but that each speaker does so briefly by telling us a bit about themselves. Thank you very much. Over to you, Mr. Mube.
Right, thank you, sir. I hope you can see my screen. Greetings to you all from Zimbabwe. My name is Bakani Ncube. I'm an MPharm candidate and Mandela Rhodes Scholar at the University of the Western Cape in South Africa, where I'm currently doing research on the implementation of the African Union Model Law on medical products regulation and the establishment of the African Medicines Agency. So today I have the pleasure of presenting Professors Admire Dube, Kim Ward, and I's publication, which is titled Establishment of the African Medicines Agency, Progress, Challenges, and Regulatory Readiness. So we're going to be looking at why is the AMA being established. So regulatory systems in African countries are different, and some countries have systems that are better than in others. These disparities are one of the reasons for the establishment of a continental regulatory system. There are also challenges that are being faced on the continent, which include implementing agreed procedures and processes, coordinating regulatory practices across sub-regions, priority setting for medical products against select diseases, the promotion of pharmaceutical manufacturing, and also optimizing the NMRA's limited resources. So these challenges have all contributed towards AU member states making the decision to establish the AMA. So also in addition, there are several donors and networks for regulators in Africa, which enhance the availability of medical products, and they serve as opportunities for us to actually improve regulatory convergence at the continental level. Therefore, these donors and networks can benefit from the regulatory oversight which the AMA's establishment will provide. Further, by aligning efforts in regulatory system strengthening and harmonization initiatives, and also by advocating for the AMA's establishment, pharmaceutical markets can be optimized and there will potentially be a sustainable supply of products for priority and diseases. So now I'm going to quickly just discuss how the AMA is being established. The AMA is to be established through a treaty that has taken into consideration some key AU decisions, declarations, and policy frameworks. This treaty for the establishment of the AMA was adopted on 11 September 2019 by the AU Assembly, and this was during their 32nd ordinary session in Addis. It was then unanimously adopted by the African Ministers of Health who were gathered at the 71st World Health Assembly in Geneva. The AMA, as you may know, is expected to be launched in 2018, and efforts were being made to ensure that the agency capitalizes on already existing mechanisms, experiences, and technologies to work in a manner that is effective towards the accomplishment of its objectives. So in the context of us moving toward the AMA's establishment, the AMA treaty must be signed and then ratified, as you've heard. So ratification is really the national procedure where a member state puts in place a law that allows for the implementation of the treaty. African health leaders are currently adopting the treaty, and on 12 June 2019, Rwanda became the first AU member state to sign the treaty. Currently, there are 19 AU member states that have signed the treaty, and only 8 have actually ratified. The value proposition of the AMA. The AMA is intended to be an organ of the AU that is legally mandated by member states, and it aims to provide a platform for the coordination and strengthening of ongoing medicines regulatory harmonization initiatives across the continent. It also plans to ensure optimal use of scarce resources by pooling expertise, capacities, and strengthening our existing networks. And the AMA also aims to offer guidance in addition to complementing and enhancing the harmonization efforts of our regional economic communities. And this will hopefully contribute to better access to quality assured and affordable medical products. And also under the leadership of the AMA, efforts in regulatory system strengthening and harmonization initiatives can be better coordinated, which may result in improved sovereign control and medical products regulation that allows AU member states to promote or rather provide protection for public health more efficiently and effectively, particularly against risks that are associated with the use of substandard and falsified medical products. Additionally, the AMA proposes to enable expedited approvals for medical products that meet the health needs of Africans, particularly for conditions that affect Africa disproportionately, while also fostering competitiveness of our locally manufactured products. So here, ultimately, the goal for us here is that instead of us having 54 NMRAs on the African continent, each with its own regulatory requirements, the AMA intends, among other goals, to result in more streamlined regulatory processes in order to enable the timely evaluation and registration of medical products. So in terms of vision and mission of the agency, the AMA's vision is to ensure that all Africans have access to quality assured, safe, efficacious, and affordable medical products that will meet internationally recognized standards for priority diseases or conditions. And at the continental level, the mission of the AMA is firstly, to coordinate national and sub-regional medicines regulatory systems. Secondly, to conduct regulatory oversight of selected medical products. And this will include traditional medicines. And third, is to promote cooperation and recognition of regulatory decisions. AMA proposes to work collaboratively with NMRAs, provide technical guidance, reduce duplicative efforts, and ensure cost-effective use of limited resources. In order to achieve its mandate, the AMA will also work with technical partners such as WHO, the EMA, and the US FDA on normative standards, technical cooperation, and capacity building. In addition, improved access to quality assured medical products may result from this enhanced regulatory environment that the agency hopes to create. The AMA will also have a coordination and stewardship function for the regulatory activities of AU member states, and it will serve as a reference center. So it's going to perform these core activities that you can see on the screen. So marketing authorization, joint assessments of GMP inspections, market surveillance, safety monitoring, oversight of clinical trials, and also coordinating quality control lab services. For functions such as GMP inspections of foreign manufacturers, reviewing complex medical products and multi-country clinical trials, the AMA and regional agencies can optimize available resources within REX by harmonizing technical requirements and work sharing activities. And also they can coordinate technical support for AU member states. What's worth noting is that the AMA is not going to replace NMRAs or the sub-regional medicines regulatory authorities, which will be established by regional economic communities. Instead, AMA desires to actually complement the efforts of NMRAs, your regional economic communities, and regional organizations that intend to create a conducive environment for the pharmaceutical industry to develop. And it hopes to do this by actually enhancing coordination of various stakeholders who are involved in African regulatory harmonization initiatives. So NMRAs are still going to assess the majority of medical products. They'll still have their regulatory decision-making roles, and they'll still put in place market controls for their specific territories. Also, we have to note that the AU does not have sweeping legal powers over the national jurisdictions of member states. So decisions that are made at the continental level are not legally enforceable in AU member states. So also the AMA aims to be an agency that's focused on developing regulatory science specialists. It will build on the experiences and strengths of the RCOR model. So this is the regional centers of regulatory excellence. And these RCORs are institutions or partnerships of institutions which have got specific expertise in regulatory science, as well as proven capacity and capabilities in the training or delivery of services in at least one of the categories of regulatory and managerial functions that are identified. The AMA intends to offer regulatory guidance on particular issues that are problematic, for which technical capacity and expertise are limited at the national or regional level. In addition, by providing recommendations that AU member states can use as a basis for their own regulatory decision-making, AMA potentially builds on the strength and capacity of regulation in Africa. Lastly, harmonized medicine registrations can actually assist the African Union through the AMA to effectively use TRIPS flexibilities for the production and import of generic medical products that are protected by patents in one or more African countries. So we're just going to look at challenges and opportunities before we wrap up. So for any continental body to be successful, there needs to be political will from the countries who are involved to relinquish some form of sovereignty for the prioritization of continental interests over their national interests. The implementation of continental decisions is oftentimes impeded by varying commitment levels to the continental initiatives, and at lower levels of integration, we have found that misconceptions should be resolved along with any differences in policy. We can look at challenges as being either internal, that is within a country, or continental. So in countries, some of the challenges that are potentially being faced are a lack of political will, there's lack of regulatory and legal capacity, and also lack of financial resources to advocate for and bring about the signing and ratification of the treaty. There may also be other issues that the country is facing, which results in the AMA treaty having less priority and being pushed down the government's agenda. We also need to bear in mind that any reforms and treaty ratifications are by nature lengthy and bureaucratic processes. And at the continental level, one of the challenges may be financing the AMA so that it actually becomes operational. So estimates say that in the first 5 years, a total of $100 million is required to fund operations. And this is broken down into money that's going to fund human resource costs, infrastructure costs, and operational costs. We do not know how much money has actually been raised so far. And AU member states have, however, agreed to provide contributions in kind to the AMA by way of dedicating part of the time of their NMRA staff for the work of the agency. And this will ensure that the AMA has a small critical mass of competent staff to enable the work of the experts and that of their respective committees. So now in terms of opportunities, I've identified two here. The first is the AMRH initiative, which was already mentioned. So AMRH initiative was formalized in 2009, and it serves as the foundation for the establishment of the AMA. The AMA can therefore capitalize on this and also other already existent initiatives, mechanisms, experiences, and technologies to work in an effective manner towards the accomplishment of its objectives. And secondly, the COVID-19 pandemic has really brought the need for continental regulatory harmonization under the spotlight. And this is pushing AMA treaty ratification higher up the priority list and agenda of most governments. There have also been increased calls for ratification by several stakeholders, including non-state actors and the biopharmaceutical industry. The pandemic cannot go to waste, so to speak, and so it is serving as a window of opportunity for AMA's establishment. And this is the last slide looking at recommendations from our publication. So we had 5 recommendations and 3 of them are directly linked to the AMA. So we recommended an analysis of the enabling factors and barriers that are encountered by AU member states in signing and or ratifying the treaty for AMA's establishment, with lessons being drawn from the experiences of the countries that have already ratified. We also recommended a comparative study between the AMA initiative and other continental initiatives in order to draw lessons from their implementation and find areas of applicability to Africa. And lastly, an investigation of African NMRA's expectations of the AMA, perceptions of their contribution to or in the AMA, and the perceived benefits of the AMA to their respective countries. So something that's not stated here that we also recommend is for more AU member states to actually sign and ratify the treaty so that we get this agency up and running as soon as possible. Thank you.
Thank you so much, Bakani. That was excellent. Thank you. Of course, Bakani does reckon that we must never let a pandemic go to waste. So never make, we must always make sure that a crisis never goes to waste. Colleagues, there's been a few people who ask questions. I will give them an opportunity to put the questions direct to the audience if they so prefer. Pumla, you had a question, as well as Carmen, and then Norman, in that order, please.
Hi, thank you very much. So my question is the MAA going to be decentralized like the European Union Medicines Agency? The reason for this question is issues that are related to political will. Sometimes, I mean, as you can see, with the ratification. Is there a plan? Is there a mitigation plan, for example, to avoid this dream from moving forward? Have you put in place a legal framework that would allow the MAA to move forward in spite of other nations maybe not ratifying it or being interested in certain? So because the EMEA is decentralized, so it does work well. Thank you. I hope I explained the question well.
You have, thank you. Bakani?
Okay, thank you for your question. So to answer it, how it's working with the treaty ratification, right, is that you need 15 countries to ratify, then the agency gets set up. And of those 15 countries that have actually ratified, they're going to form what is called a conference of state parties, and they're going to be partaking in the work of the agency, and they're going to provide financing for that, or even human resources in terms of their NMRA staff to undertake the work that needs to be done, right? So whoever has ratified the treaty is essentially part of the African Medicines Agency and will do that work, and whoever has not actually ratified the treaty is not taking part in this initiative. And then it means that they'll then have to continue regulating medicines on their own. I hope that answers your question. Thanks.
Thank you. Yes, it does. Thank you very much.
Thank you so much. Carmen, you had a question as well?
Yes, so would be to understand if the current AMRA joint assessment procedures led regionally, if it will be replaced by kind of a more centralized procedure led by AMA, or how that it will work?
Thank you so much for the question.
Thank you for your question. So yes, it has been stated that the AMRH initiative is going to be transitioned into the African Medicines Agency. In terms of, are they going to do away with the individual regional economic communities activities? I don't think they will, because it has been stated as well that AMA is not going to be coming in to replace national regulatory authorities or any regional work that's being done. So the two will coexist, and it'll depend on, does that particular work need to be done on a continental level, or does it need to be undertaken regionally? Thanks.
Thank you very much. Norman, you had a question, Dr. Norman or Professor?
No. Makes no difference. No. Mine was just a reaction to Pumla. I don't think AU has got a choice. It's got to be decentralized.
Thank you very much.
Thank you. Thank you.
I will take the last question from Dr. Sigobola. Can you please share your question with us?
Yes, thank you very much. I just have two small questions. Has anyone done a quick survey just to understand why uptake of AMA is difficult for those countries that have not signed the treaty yet? What could be the problem? And I also see in the AMA model law, veterinary medicines are mentioned under scope. Are you also aware that some NRAs do not regulate both human and animal medicines in the same house? So how do you intend to approach that?
All right, thanks for the question. So the first one, okay, conducting a study. So that's what we're currently doing now, my supervisors and I. Like I mentioned, I'm an MPharm candidate at the University of the Western Cape. So what I was presenting now was a review article that we did at the start of our study, and now we're about to begin data collection. And we're going to be looking into what are the sort of enabling factors and challenges that are being faced by AU member states in terms of signing and ratifying the treaty. And hopefully we'll have those results closer to the end of the year. So yes, the study is being done by us. And then the second question about veterinary medicines. Yes, I am aware as well that that's being done differently in different countries. But I'm not sure how the AMA intends to actually deal with both human and animal medicines. I haven't really seen much literature talking about animal medicines because most of the emphasis has been on priority diseases that are affecting Africa disproportionately, like humans? Thanks.
Thank you very much. Colleagues, we're going to move forward now.